This food distribution is coming at a time many families are struggling with soaring food prices and economic hardship.
This is to flag off the distribution of 30,000 bags of 10 kg per boy rice to further support our people, especially the less privileged and vulnerable persons. I wish to sincerely appreciate the unwavering support of our partner, the Aliko Dangote Foundation, who generously donated this rice to complement government efforts in meeting the food needs of our people. The Aliko Dangote Foundation has over the years continued to be a reliable partner, supporting the government of Yobe State with humanitarian assistance and primary health care, especially the routine immunization coverage program. This donation is yet another show of solidarity and continuous support to our administration's ongoing efforts to improve food security among our vulnerable populations and the hardship experienced by displaced persons and victims of recent fire outbreaks in some communities.
The bags of rice will be distributed across all 70 local government areas with priority given to widows, orphans and internally displaced persons.
Excellency, as you have directed previously, that whenever we are going to distribute food basket, we should be mindful of the dignity of the beneficiary. Your Excellency, 70% of the beneficiaries are under the shed with their food basket.
The government says the distribution exercise will be closely monitored to prevent diversion.
Community and local government distribution committees, you are advised to be fair, judicious and transparent in the distribution exercise. You should accord priority to the deserving persons. You are reminded that government will keenly monitor the exercise.
Governor Boni assured that more food interventions are on the way as the state battles food shortages. Michael Oshoma. Gisha, a community in Yobe State, is known for its prevalent kidney failure cases. Neighboring communities have had their own fair shares of deaths as a result of the deadly kidney failure. In its efforts to provide solutions, the state government is not relenting to come to their rescue. Now, 50 health experts are deployed to Gisha town to investigate the root causes.
This is a special intervention project funded by the Yobe State government under the leadership of His Excellency, the Executive Governor of Yobe State, Honorable Memala Buni. And the general idea around it is the fact that we know for probably over a decade now that there is a rising case of kidney disease, especially in the Bade Emirate. 2 years ago, His Excellency visited the United Kingdom, during which we had a meeting with some of the world top scientists working in this area, following which His Excellency now advised me to lead a team that will work both with these local and international scientists to understand the root cause of this problem. And as part of that, we are here in Gashua with a team of medical doctors, nephrologists, nurses, lab scientists, environmentalists, including chemists, GIS specialists, etc. So it's truly a multidisciplinary endeavor. And to the best of my knowledge, this is the largest state-funded investigation on a single health issue that I've come across in Africa. What do I mean by that? Most health challenges are funded by international organizations. I've never come across a single health challenge that is fully funded by a state government of this magnitude.
It may interest you to know that the Yobe State government, under the able leadership of His Excellency Honorable Memala Buni, has established a dialysis center at the hospital, and then dialysis is being done free of charge for all the indigents of the state. And we've been running this program for the past 8 years, 7 to 8 years, without any interruption, courtesy of His Excellency. So I think we need to appreciate that first. On the average, a majority of our patients are from this emirate. Okay, monthly, we do about more than 600 sessions of hemodialysis. When we say sessions, we are not talking about number of patients, but the sessions, one patient can have 2 or 3 sessions in a week. Roughly about half of our patients come from this emirate. So if you look at it, and then we conducted a survey sometimes last year, in which we look at all the hemodialysis center in Yobe, Borno State and Jigawa State at Specialist Hospital Hadejia, and we identified hotspots from where these patients come about. We found out that majority of them come from Bade and Jakusko local government areas of Yobe State.
Guda wajen shida duk sun tafi haka.
Some residents share their experiences with TVC News.
I lost 6 of my family members in the span of less than 2 years, including my father.
Local government or Bade Emirate has got problem of kidney maintenance. We have lost a lot of lives. As I have already said earlier, I myself have already lost about 6 of my blood relation. All of them has undergone dialysis before they lost their life. But by having this, the executive governor of Yobe State, we must appreciate him. We must to thank him. We must to say a lot on him. It seems he's a leader. He's a leader. We must to say he's a leader because he has sent professionals to us. They are now investigating the main problems in the town, and they are doing their work. His Royal Highness, the Emir of Bade, and I myself, we have already sat together and put our head together. We have already discussed, and we are going to give them maximum cooperation to do their work successfully. And they are on the work now, and there is no any problem. We are hoping, we are praying, we are hoping, we are praying to Almighty God that that what they have here to get the problems in our respective local government.
Many residents are now happy with the state government initiatives.
We are very proud. We really and sincerely appreciate the effort of the government.
After the collation of 20,000 samples from the people in Bade and Damaturu local government areas, the team of medical experts are expected to conduct medical interviews to determine whether the causes are environmental, style-related, and generic. Farming is the mainstay of Yobe State. No doubt, Yobe has suffered more food crisis due to conflict occasioned by Boko Haram insurgents.
1, 2, 3.
As a way of providing solutions to the food crisis in the region, officials of the World Food Programme, African Development Bank and MasterCard Foundation visited Yobe State to launch a solar-powered farm in Mamudo community.
What we have behind us is solar production, which is powering irrigation for what is really a centuries-old challenge for fruit and vegetable production here in Mamudo. Now, this is part of the solution to increase productivity, and I'm so delighted here to be with my colleague from the African Development Bank and from MasterCard Foundation, because as you said, we are working together collectively across northern Nigeria. Now, I'm not sure you have your numbers quite right in terms of the collaboration, but what I can tell you is that we're on a mission. We started in Kano on Monday. We were in Jigawa yesterday with the Minister of Agriculture looking at wheat production supported by the African Development Bank. Really impressive, going to scale from the dry season wheat planting. And then we also talked about some MasterCard World Food Program activities up in Bade, in Jigawa. And then today we're coming across to Potiskum. We stopped at the market to see the production potential within the Yobe State, and we're here looking at this project. Tomorrow we're heading towards Maiduguri in Borno State, and MasterCard and WFP will be going all the way to Ngala on the shores of Lake Chad, along with African Development Bank. So we're just going across the region looking at opportunities for co-investment, working also with our government partners, but also engaging with private sector partners for a new approach to humanitarian solutions.
Farming tools were distributed to farmers to ease their work. The efforts are to strengthen food system and promote increased value chain employment opportunity for youths.
We are doing $134 million in all the northern states. So in Jigawa alone, yesterday we were there with the governor and the Minister of Agriculture. We saw a lot of sites that have really made fantastic progress with dry season wheat production. I think the target for all the states, if I'm not mistaken, is around 300,000 hectares, which is going to make a significant dent, on addressing the national wheat self-sufficiency, which is a longer-term target. But on this trip, very specifically, it's a learning process. Our colleagues want to understand how we are approaching on the development side. We also want to understand on the humanitarian side so that we can develop an approach that looks at the entire value chain, not only production, but its aggregation, its processing, transportation, but also all the issues of seasonality. Of course, in Potoskum today, we visited the market, as I was saying earlier, and we also spoke to the market people because we are looking at a comprehensive solutions that will go just beyond, looking at vegetable, maize, and wheat, and so on, that will address the entire food system.
And so this is unique that the three of us come across this region together. And it's showing that we want to do things differently. We want to be more effective with production led by the people of Nigeria, in this case, Yobe State, and particularly the youth and women. And I've been so impressed to see the engagement of youth, young farmers in this initiative, as well as so many important women, including women-led enterprises that we just met here in the region.
The officials who carried out the interventions say they are planning for a comprehensive interventions beyond farming in the coming years. The Yobe State Governor Malabuni has reiterated the willingness of the state government to provide funds to ensure sustainability of the Biomedical Research Training Center at the Yobe State University, Damaturu. The fund will cover equipment, maintenance, and research projects to enable the center to meet the desired international standards. Governor Buni, who was represented by his deputy, Idi Barde Gubana, made the assertion during the opening ceremony of the 14th Conference and General Assembly meeting of the Nigerian Young Academy held at the Yobe State University in Damaturu. The director and founder of the center, Mahmoud Bukamena, who doubles as the special advisor to the governor on research, science and innovation, speaks more about the events.
It's historically considered the birthplace of science innovation. The first stone tools were discovered in Africa, showing that Africans were the pioneers in this area. But yet, Africa is lagging behind. And as a result, we have brain drain. Talented African scientists leaving the African continent, going to the global north in search of better opportunities. And of course, this presents a highly problematic challenge because we need them to solve our local problems. And this is exactly why, with your support and the enabling environment provided by the Yobe State University, we established the Biomedical Science Research and Training Center 3 years ago here in Yobe State. And with all sense of humility and gratitude to Allah subhanahu wa ta'ala, this center has at the moment equipment worth over 2 billion naira. We have some of the best equipment in the entire country, including 2 confocal microscopes, which are only a few in the entire African continent. And of course, Your Excellency, when you launched this center 3 years ago, we made it very clear our mission is bold, which is to train the next generation of African scientists. Make this center open access so that Yobe will become a beacon as well as a scientific hub of excellence within the African nation. And already We have trained over 450 doctors, scientists, and other professionals, not just in Yobe State or in Nigeria, but from Cameroon, Ghana, Egypt, the Gambia, and other parts of Africa.
In his remarks, the State Commissioner for Higher Education, Bello Kawua, described the partnership between the state government and the research center as essential.
Also is to appreciate the founder of BioRTC, Dr. Mamudo for the foresight and the ingenuity in identifying the need to have this unparalleled resource center in our university. At BioRTC Center in Yobe State University leads in cutting-edge research, especially addressing our local medical challenges. We look forward to further partnership with the center to build the capacity of our academics in the state tertiary institutions, especially in science and biomedical research, for our academics to be able to be in tune with the use of AI and the standard modern protocols in science, research, innovation protocols.
I want to assure you that your efforts are not in vain. The work you are doing today, the questions you are asking, and the problems you are solving will resonate far beyond the walls of your institutions and boundaries of this country. They will shape the world for generations to come. For those of us in Yobe State, we are happy that what we are doing within the four walls of Yobe State University has gone beyond Yobe State, has gone beyond Nigeria, has gone beyond Africa. We are all over the world. I'm grateful for that. Only 3 years. I'm sure in the next few years, Yobe State University will be a university of recognition across the world. Last week, I was with a group of students at the University of Maiduguri, and they're talking about analysis of their data. And they mentioned Yobe State University, that they have the equipment. Then they quickly said there's something called BioRTC. I started laughing. I said, this is in my university. Please come.
In his speech, Governor Boni pledged continued support for the university's Biomedical Research Center.
I gladly wish to welcome all our distinguished invited guests, participants, and everyone to this significant event. Earlier, I was made to understand that this meeting is going to dwell on matters relating to biomedical science, Research and Training Center, BioRTC, to achieve appropriate response to the existing and emerging challenges that affect citizens' health and well-being. As we may be all aware, the BioRTC was conceived by its founder, Dr. Mamudo, with objective of inducing science, research, and innovations for speeding up growth and development within the state in particular and beyond in general. Therefore, there's no gainsaying that the fact that this common drive of ours is geared towards serving humanity in its entirety. Obviously, our august visitors from across the country and even beyond may have similar belief and equal zeal in promoting knowledge and progress of all people, and this is underscored by their presence in our midst today. Yobe, as a state that was inflicted with over a dozen years of incidency, with devastating consequences on all facets of our lives, needs a deliberate and concerted effort to ensure quick recovery.
As a way of discovering talent in Yobe State, The State Ministry of Youth and Sports, in conjunction with other partners, organized Governor's Cup football competition for the 17 local government areas of the state. Flagging off the event at the August 27 Stadium, the Maturu, the State Commissioner for Youth and Sports, Barama Shitima, commended Governor Boni's unwavering support and renovation of the stadium and other sport infrastructures in the state.
This state-of-art facility is a testament to our administration's commitment to promoting sport development in Yobe State. The AstroTurf football pitch will provide a safe and conducive environment to train and compete. As we gather here today, I would like to express my gratitude to His Excellency, the Executive Governor, for his unwavering support and vision for sport development in our dear state. This competition is aimed at promoting unity, teamwork, and healthy competition among our teeming youth and serves as avenues of discovering indigenous talents. The Ministry's appreciation will not be complete without expressing our heartfelt gratitude to the state government, also for the recent construction of shed for sitting segments and the construction of VIP lounge in our stadium. These infrastructural developments have significantly enhanced the overall aesthetic appeal and functionality of the stadium.
Governor Boni addressed journalists on the objective of the event.
I congratulate the ministry and all other good people of Yobe State for this edifice, and I want to assure the good people of Yobe State going forward we will do our best to ensure that such a sport is encouraged, especially catching them young. We're going to serve as talent hunts, especially bringing all the local governments and all other communities together to participate in this competition. Is really encouraging, and as a government we will do our best to ensure that we develop sport in Yobe State, not only in the area of football. We are planning for other sporting activities like traditional wrestling and other sporting activities, actually to engage people in their various sporting activities, and I'm sure it is going to serve as a talent hunt.
It speaks more on plans for effective maintenance of the renovated stadium.
The maintenance culture must be our priority, and especially the ministry and then the management of the Desert Star. Particularly, they are the major beneficiary of this edifice, and we are looking forward to hosting so many sporting activities here. So this is quite commendable, and I want to actually draw the attention of all of them to ensure that maintenance and maintaining the standard of the pitch and all other activity edifices that it's put up.